Yeah, so I think if it's, again, one of those very few and far between medical facilities that takes one CF a year and you're that chosen one, then I believe the supervision, I know that's a big part of it, is like you have a built-in dedicated supervisor. The challenging piece with medical is finding somebody that is going to be able to dedicate that time. Because what you don't want, and this is what I ran into, was that he felt like he was going to be able to do this. And he was a great clinician, great person, just truly did not have time. And our schedules never aligned, because he had patients. And then it's like, okay, this happened. And then I would have situations where I was like, I really need you. And they just never aligned. So he could not really be there for those times when I really needed him. And so it was harder to schedule dedicated time because I never know who I was going to be seeing, what my day looked like, because patients come in and out of the hospital. So there's not like a dedicated, unless you're doing inpatient rehab or outpatient where okay, I know kind of more of what my schedule will look like beyond day to day. Whereas a school, I feel like it's easier to schedule that supervision and to say, because oftentimes it may be somebody who also works for that district. So they can, you have the same general school schedule. Even if it's not somebody that works for that same district, but an SLP in the area, it's easier to schedule that supervision because your schedule is pretty much set where Monday, every day from 9 to 10, I have this group every day. So if you need help with a specific group, and you can say, I'm really struggling with this, I see them every Monday from this time to this time, it's easier to actually schedule that time in.
Yeah, that makes a lot of sense.
Yeah. And also, I feel like, even knowing ahead of time, hey, every Thursday at this time, from this time to this time, we have our IEP meetings. Can you be part of that and be there for me at that time? So that just makes the scheduling of it easier. I feel like in the medical setting, you just have to really, really be very diligent and purposeful about how you're doing it. If you say, because you may say, hey, I have every Monday from 9 to 11 blocked off for you. But whoever you get during 9 to 11 at that day is who you get. So sometimes that could work out because it may be that those are patients you need help with and guidance with, but who knows? You don't know because the census and the patient population is changing. If it's skilled nursing, that may be easier to schedule, but again, that's the challenge with medical, is just making sure that that person does not have such a full caseload or medical load themselves that they will not be able to break away. If they're like, I'm trying to get through all my patients, there's no way I can get over and help you.
Yeah.
And this is where communication is key. And if I could go back, I would have asked different questions and really just because I was like, will you be my supervisor? Sure. That was the extent of my process. And then I realized,
you grilled her.
This guy didn't.
Yeah.
I mean, it was pretty extensive. I was like, I wish I would have known all these other things so I would have asked, said, would you be my supervisor? Are you able to supervise? And even if a facility or school assigns you a supervisor, having that be your first meeting is like, I'm really excited. What's our schedule going to look like? What do you know? What time are you going to have to dedicate? Should we set this up twice a month for these observations? Should we do once a week? What's going to work? And make sure that time that's set. Like, don't you move it and don't let them move it unless it's absolutely necessary, because that time should be prioritized just as any other time. So talk to them. What does your schedule look like? This is what mine looks like. How are we best going to communicate? If I run into a real problem, and again, this could be even somebody who's in the next door school or the next facility, they just can't drop everything when every time you call and run over there. So what's our process? And if I have a question during the day, or if I get stuck on something, can I text you and then you call me as soon as you get a break? Like, what's that going to look like? And just, how are we what's your preferred method of communication? This is my preferred method of communication. The more you can outline that process from the beginning about what are each person's expectations about what this is going to look like is going to make the process just so much smoother. Yeah. And I wish that I would have done that, because I would have then realized we didn't have any plan in place. He didn't realize also where I was going to really need the most support. Mm-hmm. I didn't think I even realized what I was going to do. So we just did not have a plan in place, and therefore it was not successful. So having that conversation and making sure that you really stick to it, because sometimes it's not the supervisor who's changing things around, it's the CF who's like, oh, this isn't going to work for me. No, you keep that unless something really, really important there's a very important reason it needs to change. That's like sacred time with your supervisor.